Anemia is defined as a low hemoglobin level, generally below 13 grams per deciliter in men and below 12 in women. Hemoglobin is the protein in red blood cells that carries oxygen, so when it's low, the body's oxygen carrying capacity drops. We classify anemia by the mean corpuscular volume, or MCV, which tells us the average size of red blood cells. In microcytic anemia, the MCV is below 80, meaning red blood cells are smaller than normal. This usually happens when there's a problem with hemoglobin production. Common causes include iron deficiency anemia or IDA, often from blood loss or poor intake. Thalassemia, a genetic defect in globin chain production. Sideroblastic anemia, a condition in which iron can't be used properly to make hemoglobin. Anemia of chronic disease or ACD, where inflammation traps iron in storage. In normocytic anemia, the MCV is between 80 and 100. The cells are the right size, but there just aren't enough of them. Normocytic anemia has two main causes. First, decreased production, like during early stages of anemia of chronic disease, where iron is restricted but not severely enough to shrink the red blood cells, or in aplastic anemia, where the bone marrow fails to make enough cells. Second, increased destruction, like acute blood loss or hemolysis, where red blood cells are lost or destroyed faster than they can be replaced. In macrocytic anemia, the MCV is above 100, meaning the red cells are larger than normal. This typically results from impaired DNA synthesis, which causes the cells to grow but not divide properly. The most common causes are vitamin B12 or folate deficiency, often due to malnutrition, alcoholism, or GI malabsorption.